Hello, everyone. Thanks for making the time to be here. It's going to feel very formal because I have to use this because they're recording, but please, we want to have discussion too, so don't let that limit you. I wanted to first introduce myself. I'm Kathy Zakowski. I am an occupational therapist and a movement scientist from Kennedy Krieger.
And I'm Jennifer Keller. I'm a physical therapist, and I work in a research lab where we've studied movement in people with leukodystrophies for about 20 years now, mostly with AMN, but we also have a number of natural history studies going now, so on different leukodystrophies. So.
Yeah. Thank you. That's very good. I forgot to mention the laboratory part. Anyway, we're here today to talk to you about mobility guidance for leukodystrophies from our perspective. Okay, in terms of an outline, just to give you an idea of where we're going, I'll start talking a little bit about neurorehabilitation and the importance of kind of a neuro rehab team. Then we are going to define a few symptoms that we think are key symptoms in leukodystrophies, but we'd love to hear your input about that. And then we're going to describe guidelines for interventions and recommend steps for how you might be able to use different adaptive equipment and select the right equipment for yourself or your loved one to improve mobility. So we know that that when you see a medical professional, often it includes a physician, and then there's this neurorehabilitation piece. And so what I was hoping to show here is that to emphasize that neurorehabilitation experts will treat people with functional disability. So this includes physical therapists, occupational therapists, speech therapists, even recreation therapists, depending on where you're at and what kind of resources you have. Any of these individuals have a very different perspective from your physician. And so we get a lot more training in terms of human movement and how to improve that. And so it's important to appreciate that it's not just getting more physical activity, as you can see in the spokes in the wheel here. It also includes how much sleep people get, how stressful the situation is, mental health issues, the different kinds of medications that people are on, and nutrition and other factors. So neurorehabilitation is designed to try to get at how all of those factors can impact a person's function. Now, what we know on the far left here is that in the human body, we have a nervous system that can stimulate muscles and allow us to, when the muscles contract, that helps to move our limbs and our trunk in purposeful ways. We know in certain pathologies like adrenomyeloneuropathy, for example, that there are particular pathways that are damaged. And that's what the middle figure is designed to show you. So we know there are nerves that are important, that are very specific for certain pathologies. What we've learned from our studies is that there are several symptoms that are very common to the leukodystrophies and will affect movement. So we know there is sensory loss, and we can measure this using vibration. We also know there's often progressive weakness, and this weakness can be from the pathology itself. It can also be from the fact that it's harder to move, so people move less, and so now there's a disuse atrophy. We also know that the amount of muscle tension that all of us have, that muscle tone can be altered because of the pathology. We also know people often have difficulty walking and have poor balance. So understanding how these key symptoms work and may work together might lead us to intervening in a really practical way. So I'm going to start with defining weakness. So we all know generally what weakness is, right? It's the reduction of strength in one or more muscles due to a pathology that in turn affects function. And we've done studies to better understand how and whether exercise can build strength in adrenomyeloneuropathy. And what we've found is that we need some kind of resistance. And so we use these bands that you can see on the right to provide the different color of band provides a different level of tension. So it's similar to kind of using weights. We also, I show a table here on the left just to demonstrate that it's important not only to have the right resistance, but also to do the right number of repetitions. You need to have a certain amount of effort. It's going to be uncomfortable if you want to make gains, and even have a goal for what you're striving for in order to make gains with exercise. We set this up kind of like an old-fashioned prescription pad just to emphasize the point that these interventions are very similar to what a physician may suggest, although it's not a medication, right? So when your physician writes a medication prescription, there's a certain amount that you take of a particular kind of medication. And it's the same thing with exercise. We think that it's really important that you are evaluated, and we can determine which muscles are weakest. Then we can determine what intensity and how many repetitions you would need to do. We found in our study that after 8 weeks of increasingly providing increased resistance, that people can make gains, similar to someone without a leukodystrophy. And we took this to even 12, up through 12 weeks, people can continue to make gains. But it required increasing the amount of resistance weekly, and sort of monitoring how much effort people had. So how much effort are you putting forth to complete the task? And so these are kind of the important parts of an exercise program. Not only what muscle, but also what exercises will target that muscle, and to how many repetitions and to what intensity. Another way to stimulate or to get muscle contraction is through something called functional electrical stimulation, or FES. The way this works is different than when we try to move. We can voluntarily get our muscles to contract. When that becomes difficult, you can also put a pad on the muscle, and a small electrical impulse will help drive that muscle. It can be worked on actually even in addition to what you're trying to do. So it helps to supplement when people are unable to contract the muscle. There are different versions of this that can be used in walking. So just to give you an idea, this device, there are several versions of this, different companies have them. And the idea is that you can wear this on your leg, and it stimulates one muscle in your calf, the muscle that allows you to lift your toe as you bring your foot forward. So often people will complain of having foot drop, if you've heard of that term. So this device works by stimulating a nerve that is very superficial right below your knee, and can provide an electrical impulse at the right time of your walking, so that you can bring your foot forward without dragging it. This is meant to demonstrate that it's very specific to one muscle, but if that's the muscle you're trying to drive, it can work very effectively. There are downsides to it in that it's very expensive. So I think around $5,000 for one, is that right? Maybe even, yeah, I can't remember now. So from $5,000 to $8,000 for one. And insurance will in rare cases pay, but not consistently. There are also, there's this top device up here on the top right section. I guess you can't see my cursor. On the top right, called neuromuscular stimulation device, is another version that is less expensive and is something a physical therapist can show you. It's not timed to your walking quite the same way as the other two devices, but it can drive a single muscle, whether it's the muscle in your calf or a muscle in your upper thigh or in your arms, and can be used as an exercise. So it can help to build strength in addition to being used during a functional task. We know there are a lot of mobility devices, so we kind of, Jen and I tried to put together what are the different options that we have, and it depends on the side just means it has to be specific to your particular needs. So for example, functional electrical stimulation is fantastic if you have the resources and if your peripheral nerves are healthy, because as I mentioned, it works by stimulating that nerve down here in your leg. And if that is not a healthy nerve, it won't work. You also could use a cane or a walking stick. So that might offer you might even just use the cane or walking stick while you're exercising so that it gives you a little bit more peace of mind so you can work at that higher intensity without feeling like you will fall. Same thing with using a walker. These devices are typically used just for walking, but you can choose to use them just as a tool when you are exercising. A scooter also has specific needs. So a scooter is great if you need to get from one place to the other, but you have to have the right amount of trunk control and strength, right, to be able to hold yourself up on the scooter. And there are different types of wheelchairs. So a manual wheelchair, which you have to kind of move the wheels on your own. There's also something called a manual assist wheelchair, which has little motors built into the wheel itself. So as you're pushing it, it can give you an assist. So it's great for going longer distances or up hills. And then there's a power wheelchair, which has all sorts of ways to individualize and tailor to the environment that you're in. And then there's adaptive bikes as another way of trying to get to adapt your interest. If you're interested in riding a bike and you can't do it on 2 wheels, now they have 3-wheeled bikes that are adaptive and more stable and might be an option. All right, I'm going to pass it off to Jen to talk a little bit about imbalance.
Thanks. So yeah, the second symptom that we wanted to talk about was balance or balance control or imbalance, if you want to say. There's a number of different things that can contribute to feeling off balance or having problems with your balance. So you can have problems with your sensation. Like Kathy said, we measure vibration sensation, and we do that because that is in the same pathway as what we describe as proprioception, which is knowing where your body is in space or how much you've moved it. So as I stand here and sway a little bit, I can tell how much I sway at my ankles. But if my proprioception is like slow to respond, I won't really know until I've shifted quite a bit further till my hips have actually moved that I've changed my position. And so then that makes me more at risk of falling. If I've moved too far backwards now and I've gone too far, I have to take a step. Additionally, there can be in different leukodystrophies impairment is the cerebellum, which is a region of the brain that's important for coordinating movement between different joints. And so it's also important in maintaining your balance. So coordinating your joints in order to stay upright. And so if that's impaired, that can also contribute to falls or to walking abnormalities. So in both of these situations, we find that performing balance exercises is an effective strategy to work on improving that. And these are just to give you some examples. I did a study in adults with ataxia, and they did a home exercise program for 6 weeks where they did 3 sitting and 3 standing exercises, and they did them on different surfaces. So if they were very unstable, they just did something on like a hard floor or a seat. But if they had better balance, or they could maybe try to do it standing on foam or sitting on a tilt board. And they worked on these. We made them to the right degree of challenge for them so that they could challenge their balance or work on their balance on their own without needing additional support from someone else. And so we progress those exercises by doing things like turning your head or shifting your weight from side to side, reaching, or maybe doing some foot movements or decreasing how much base of support you have. And as Kathy said that we talked about for strength, we kind of designed what we would consider a prescription for balance, which would be doing at least 20 minutes a day for 4 to 5 times a week for 6 weeks. That's how long it took for us to see a change in people's, not just in their balance, but actually in their walking. So their walking improved from doing balance exercises alone. But the key thing, as I was sort of pointing out, is that it had to be challenging, but it had to be safe. And so we really want you to be able to if you need support, you can use it, but we don't really want you to hold on the whole time while you're trying to practice standing on one leg, because that won't really be stimulating your nervous system to make adjustments and improve your balance. And there are a lot of different mobility devices that support imbalance. So in order to maintain your balance, you need not only your sensation and your cerebellum, but you also need your vision. And so if something else is impaired, you can, harness the ability to use your vision. Don't walk around in the dark at night. Make sure you have a light that you can turn on and you can rely on your vision. Have a point that you can use to know if if you are swaying more. If you focus on a point, people find that, easier to maintain their balance, because it's sort of a reference to how much you might be swaying. Similarly, you can use a cane in your hand to sort of, if your hand sensation is intact, you can basically use that sensation that you maybe aren't getting from your legs to help maintain your balance. So as you're standing, you can just lightly touch a support surface or a wall, and that will help you keep your balance better. It's not holding on to it, it's just getting that input that you're not getting from your legs as well. And then similarly, you can use a cane in the same way. So it's just making your arm longer, so it's touching the floor. You maybe even see some people, they're not really swinging it and using it like you would for weakness, like leaning into the cane, but you're just using it to have a better sense of how much you've shifted your weight from side to side while you're walking. We're going to talk a little bit more later about optimizing your environment for safety, but you definitely want to take into account that falls are very costly. And so doing everything that you can to prevent a fall is important. And then walkers are, give you the ability to use both arms and have some more stability. Personally, I don't think we see them in adults as much as we see them in children, but I like a reverse walker, which is one that goes around behind you, and then you can take steps forward, and you don't have to worry about where you're placing your feet and kicking the walker. But they are wider, so they take up a little bit more space. So it's just something else to consider. So our third symptom that we wanted to talk about today was altered muscle tone. And this can be quite a range. There's a range of normal tone. You think of all the people that are kind of double jointed who can, I'm not one, I'm a stiff person. So, but, they can move a lot further. They can kind of overextend their elbows or their knees. And then there's the other extreme where you have a lot of tension in the muscle. It can be so much tension that that like a wrist ends up, getting kind of fixed in a bent position, or the ankle is hard to lift the toe, and maybe get like some tremor in the leg as you're stepping. And it's a wide range, but what the tone mostly influences is your alignment. And so what you really need is to be able to manage it in order to have the best range of motion at your joints, and to start from a good place. So in terms of posture, it's really important to know that your alignment is right, whether you're lying down, standing, or sitting, and to support it as much as needed. And then the other thing that we usually think of in terms of managing muscle tone is flexibility. So stretching, and stretching on a regular basis is typically said to hold for a minimum of 20 to 30 seconds at the end range, not without bouncing. However, with increased tone, we usually suggest longer periods. So you can see in our suggested prescription for addressing tone, we would actually suggest bracing as a possibility to maintain that end range stretch for a longer period of time. It can be as long as 4 to 8 hours a day. And if you need to have a more intense bout, we've even done casting for up to 6 weeks and continuously stretching further. And then for lower tone, you really want to support that. You don't want to always bend your knees, your day standing with your knees overly straight. It's just a lot of strain on the knee. So those things can be supported by ankle braces or therapeutic taping, or even just like an orthotic in your shoes to help you with better alignment. And teaching yourself, cueing yourself over and over again, kind of like when your mom did when you were a teenager, stand up straight. That's kind of just another way to practice and manage. As I mentioned, there's a number of mobility devices that can help support tone. So, proper seating, maybe in that wheelchair, you need some trunk support on the sides to keep your body upright. Custom orthotics and braces. So I'm showing like a insert for your shoes, but an ankle foot orthosis, like the taller brace, can help keep your foot up, and also help stretch out the back of your calf. And then therapeutic taping, and this, as we've said, a cane and a walker are good for helping maintain your stability, protecting your joints, and also if you have increased tone, from having that tone kind of throw you off balance. So we kind of wanted to talk about, what you can do right now. So you can think about what things you might want to change. And I like this framework. A friend of mine put it together, also named Jen, about yourself. Like, what would you change about yourself? What could you change about the strategy that you're using day to day? And what might you be able to change about your environment? And so we'll start with just about yourself. I think that is just a continuation of what we've been talking about. It's important to individualize this exercise program, strengthen the muscles that are weak for you, work on challenging your balance at, intensity that's appropriate, and maintaining your range of motion. But also we didn't talk much about, but just staying active is really important so that you can avoid that disuse atrophy that can compound or add to symptoms that you have. And then I guess I'll let you take over for strategy for us. Yeah.
Okay. Now, about the strategies you can use. So what strategies can you change? So there are things you can do that might seem very obvious, but it's sometimes the most obvious things that we have to kind of be reminded about. So things like taking your time. It's to the point where even when you go from sitting to standing, you pause before you move on, just to make sure you have your feet under you and you're ready to go. That can often limit problems moving forward. Simplifying movements. But what we mean by that is, oh, sorry. Thank you. I didn't know. What I mean by that is, doing one thing at a time. So slowing down just enough to be able to do more than one thing at a time, or just splitting it up into two different tasks. Giving yourself permission to accept help. So this sounds very obvious, but even just the little bit of getting help as you stand or getting help with kitchen tasks might be, is it not working? Oh no. Did it work? It was working just fine. I didn't even notice. Should I keep going? Well, as you're sitting here, what I would recommend, start thinking about questions that you think are specific to your particular issues, because part of our goal is to share what we have learned from all of the studies we've done, but also to be able to address specific questions you might have. And so, we started out with, there are things you can do about yourself. This section is really about strategies you can use that are simple, and you might have better strategies that you'd want to share with people too. And we'll be happy to take those questions at the end. Yes, go ahead. Do you want to address that, Jen? You have more pediatric.
Well, I think we always say it depends, right? And I think that's another reason, as Kathy was saying, like it's really important to have like your specific symptoms or the child's specific symptoms assessed, because if weakness is a big component, I think a walker can really help just get that repetition and more a dose of moving the legs forward over time. If balance is a problem, I think you're gonna have to spend some time out of the walker, or maybe standing with the walker, but doing some reaching. So you're only using one hand at a time so that you can work on the balance rather than just the balance being held in the walker for support. And there's just different components to it for that reason. So, and then I think progressing the walker is an important thing just to keep in mind as well, because there's a lot of different walker options. And so a really wide, heavier walker is going to give a lot more support, but you could start to kind of decrease that support by modifying what kind of device somebody is using.
Good questions. And good to hear the answer around other, you know what, I think, should we wait for questions or should we just take them now? All right, go ahead. That's fine. That's fine. No, you can go ahead and ask because now you're thinking of it. Go ahead. Right. So that's a really, it's a good question. So, part of the caregiver's job will be to make sure to keep some flexibility of the joints, since she's not able to do a lot of the activities that would require probably extending her limbs she probably moves within a limited scope, if that's, so I think one thing would be to, it's fine. It's good to have her keep moving as long as she's in a safe environment. But making sure she stays flexible, making sure she maybe sees, I don't know, like if she has a goal, or if you have a goal for her, if she can try to reach towards something to try to use some of the involuntary movement in some way, that might be something you can work towards. You have other suggestions?
Actually, it's become popular in just the general population, but something called like functional training. And so using just your regular daily activities as a movement. So rather than just rolling to the side once to get up or to change, you just do rolling over and over and over again as the exercise. So use that daily activity as the exercise if it's possible for, and just start where I think you are or where she is at that moment. Like, what can she do? Even just breathing exercises and things like that can be beneficial, especially when you spend a lot of time, without moving on your own.
The units of the functional electrical stimulation, that can, the FES machines or devices can stimulate or make certain muscles contract. So if there are movements that she's not doing and you are worried about, for example, everything is inward and nothing is outward, you could try to strengthen the muscles that would help her bring her arms out, for example. That would be one possible way to use a stimulation device like that. Very different than the way I showed you for walking, but to counter the movements she might be doing in one direction, because you want to have a balance, right, of what we call the agonist and antagonist muscle, right? Muscle going one direction and the other. Yes, question. Yeah. That's a very good point. So, we would recommend going to a physical therapist or occupational therapist that has some neurology training. So you don't want to go to someone with an orthopedic background, because that's very different issues than what you have with any of the leukodystrophies. And the idea with your therapist would be to design an exercise program that either the person, the patient can do on their own, or they can do them with a physical therapist, or you can hire an assistant or some kind of trainer. There might be situations where you could go to a gym and use certain pieces of equipment. So I think it's going to be very individualized, but I would go to your PT or OT and tell them, this is my goal. I want an exercise program for my daughter or son, and I'm unable to be with them every minute while we're doing it. Can we design an adapted exercise program that they can fulfill without me having to do it with them, and see what they can come up with? I have a couple ideas. So one would be to go to the gym and say, this is what I'm looking for. We belong to your gym and we're looking for a trainer that can work with us individually. And they often will know people local that are wanting to do that kind of work. Another thing is, if you find someone who's interested or your son works well with, but isn't very well trained in this, there are training courses you can do online to learn a little bit more about exercise. The National MS Society, for one, has kind of a training module that's free for someone to learn a little bit more about exercise and how you might help someone safely do some exercises. I don't know, do you have other ideas?
Actually, here in Chicago, the Rehab Institute of Chicago, on their website, they have a prescription that you can take to your PT, and it will check off all of the equipment, things that would be appropriate for the person, and recommend like a starting, level at which to do it. And then it has like a section at the end for them to put precautions for things to look out for, and that as well. And then I don't know the site off the top of my head, but there are some personal trainers that are trained at working with people with disabilities, and they get a certification, and there's a search for that on that website. But I'll have to look for that, and maybe I can get it to the ULF to post after this. Okay.
Okay. Well, should we go ahead? Let me finish. We're almost done. Let's go ahead and finish. So what can you do to your home to make it a safe environment? Why is this not? There we go. So again, these might seem obvious, but I'm hoping they're good reminders. So choosing a chair that you can get on and off of. There are different, so what you can see, the two examples here, some chairs that are lower are much harder to get out from. Chairs that are really soft are really hard to get up from. Chairs that don't have arms makes it really difficult. So before you sit and you have that trouble of how to get up, kind of plan where you think the best sitting options are. You really want to limit fall hazards. So obvious things like remove area rugs, or if you really like the area rug and you don't want to get rid of it, I would tape the corners down so that they don't roll and get stuck when someone is kind of shuffling through. Be sure to clear power cords or any cords, even computer cords that might be in the way. Use night lights, again, to kind of allow your vision to provide, a little bit more of a warning before you get into a situation that you can't get out of. And watch for things like water on tiled floors or floors that might get slippery with water. And then to the right, it was a little bit more about, adapting your home in ways like adding handrails or grab bars on the stairs or in the bathroom or in the kitchen, wherever this person is spending time. Make sure that you're kind of thinking about, you just need a little bit of support at the right moment. And if that support isn't there, then you fall, right? And that's a much bigger problem and risk. So kind of thinking, like walking through your home and trying to imagine where you think support might be needed, and being able to add things like handrails and grab bars. Oh, and then I think you're going to talk about.
Sure. So I just wanted to put up a couple of different options for patient lifts that can help, caregivers transfer. So these aren't, I'm not, suggesting these are the best choices or anything, but it's the one on the left is new to me, but it folds up into a bag, like a backpack that you can move around, and you can get someone who's fallen off the floor with that. an adult. Actually, there was someone who brought that to clinic that introduced me to that with AMN. And then in the middle, I think is the more common thing, like a Hoyer type of a lift with a sling. And that can be used more easily to transfer from a variety of surfaces like chairs or a hospital bed and that kind of thing, but it takes up quite a bit of space. And then the one on the right is like a sit to stand assist. So it can help with toileting or standing and transferring if that's still an option. But I would emphasize that it's really important to consider these early. You want to protect everyone's body, so caregivers as well as people with leukodystrophy. And so just trying things out ahead of time is a good idea. Let's see. So we like to just give you guys a little heads up about like how you might find a rehab specialist. You know, you want it to be somebody that you can work well with, like that's willing to, you know, most people are probably not going to know much about a particular type of leukodystrophy. And so you want someone who's interested and is able to learn about that. But you can also search for people who are specifically trained in or work with frequently. Like you wouldn't go to a surgeon who hasn't done very many knee replacement surgeries to have your knee replacement. So likewise, you can just call people and ask, you know, how many people have you treated or do you treat on a weekly basis that have, you know, a neurological disorder. And MS, spinal cord injury and stroke are very similar. You can seek out a university center. I think one thing the pandemic has made more possible is how much telehealth is available. So if you're in a state, but it's far to go to a university center, maybe just even getting an evaluation or consult by that means is a good option. And then, you know, being sure to ask questions and make sure you have good communication. And also for you to tell them what you want them to do for you, what it is you really want help and make sure that you're an active part in setting the goals that you want to achieve. For physical therapists, in particular on the American Physical Therapy Association website, the apta.org, they have something called Find a PT. And in there you can enter your zip code and find listings. You can specify that you want someone who's treats people with neurological injury, and they will come up with, you know, people that are listed who are members of the APTA to be listed there. So it's a little bit smaller than just the whole, you know, statewide, but it can give you a good starting place.
All right. So just to summarize, we started out by kind of talking about how interventions like exercise can be considered like medicine, right? So it's not that you just have to do the right exercise, you have to do the right dose of that exercise and have the right intensity, and even link that exercise to what your functional goal is would be another way to approach it. I really want to encourage you to like know who your neurorehabilitation specialists are, because you can call on them for different issues, right? So having, in addition to your physician, knowing a PT or OT or speech therapist, depending on your needs, can help. And you might not need it now, but knowing who they are, being evaluated can help along the line, like down the line. Also, we identified a few symptoms from our studies that we found important. So weakness, imbalance, and altered tone. I would encourage you to know what your symptoms are or your loved ones so that you can determine how to target those. And then personalizing your program is kind of the overall message here. You want to identify what muscles are weak so you can individualize your exercise training program. You want to be more active overall. And you want to customize the adaptive equipment options that you have so that they can allow you to do the things you or the person with the disability has. So we really encourage you to get started today. All of these things, of course, take time and effort and resources in many cases, but exploring and being kind of directed in what it is you're looking for might allow you to make a little bit more progress. And we're happy to take questions now, and we're also here the rest of today and at least through tomorrow morning. Thank you. I think that was it, right? I guess before I end, I want to for sure acknowledge the many patients that have been in our studies and have allowed us to learn all this information in the Kennedy Krieger Institute, where we do these studies. Thank you. Yes. So Botox is an intervention that can decrease tone in very specific muscles. It tends to do better in smaller muscles rather than larger muscles. And it has a lifespan. So when you get the injection, it will improve things for three to 6 months, depending on the tone. But is not. And so often what we would recommend is if you have Botox, you use that time to do a lot of stretching, increase the flexibility while you don't have all the tension in the muscle, so that when that medication or intervention wears off, you've made some progress in terms of flexibility. Any other questions? You can pull some from the, yeah. Sure. I don't know if I can read them. You want me to read them out loud? Can you please talk about orthotics, specifically UCBLs, to help with pronation issues? Do you know the UCBL?
I have to figure out what the acronym is for. It's just how high it goes. Okay, thank you. Right. Okay. I mean, let's see, to help with pronation issues. I mean, I don't know specifically, to be honest, about that type of that. I mean, I've used a variety of different ones. I mean, I think that it's really important, especially, so I mean, our experience is more with AMN, but as we've definitely found that people get plantar fasciitis type of pain, which is can occur similarly with people who are overpronators. So something like that is a good way to get a good support. We also start to see people get sort of a higher arch. So you want to have your arch supported in order to, you want your foot to have a good flat contact as you're walking. So that's one other thing, and to give your ankle some stability. But that's often not possibly enough support. And that's why we sort of showed the ankle foot orthosis or something higher to give you a little bit more stability as well.
What about a child who has never stood or walked independently and is no longer tolerating as much time in a standing frame? He has severe hypermobility despite leg leaders and AFOs. Physiotherapists have advised no standing exercises, just standing frame.
I just need to reread it.
And I'm handing it off to Jen because she's more of a pediatric physical therapist too. But I would, yeah, I can understand the problem. I'm not sure what I would recommend.
It's always hard to talk about specifics, and I can't see someone, and I'm hesitant to do that as well. I think that there are a lot of advantages to being upright and to standing, no matter your ability levels. So if it's possible to use more support to spend more time in the stander, it's just being upright has a lot of benefits besides just for leg strength, but for GI system and respiratory, and then just being able to be easier manipulated in bed and managed that way. So we do usually encourage standing as long as possible, not as long, not for all day kind of thing, but for, duration wise, not to give up Cool. So that might be another possibility, to kind of be able to be more supportive, and then also to not stress the joints as much. That would maybe be a possibility to try aquatic therapy as well.
The next question, what is your understanding of the use of helmets in leukodystrophy patients? I have a 3.5-year-old who's mobile but clumsy and at risk of falling. So I would recommend wearing the helmet. I guess I would worry about making sure it's not too heavy, but you might have other suggestions too around that.
So I just had to get a helmet for a child with leukodystrophy. I did not know that they are not often covered by insurance anymore, and they are not being provided by DME providers, which are, your equipment provider. So you do have to, a number of the sites do have instructions for how to measure for them. So you can measure for them yourself, or you can ask I would probably recommend ask your OT or your PT to help with the measurements, because they do use landmarks that are maybe not that familiar. And then also, so as Kathy said, making sure it's the right size. And they have a description. I mean, I think it's a good idea, and just even preventing scratches or injury from that as well. But they are not, guaranteed to prevent like a head injury, but I think to give you a little extra protection, and a lot of my patients do wear them. And they are looking a little bit more common, I guess is what I should say. So some people I know have not wanted them because of how they look, but I think they're used more commonly for a lot of different things like torticollis and things like that. So I think it's more socially acceptable too.
All right. I think those are all. Any helmet type recommendations? Thank you. Oh, well, do you have any specific? Because you just.
I think it's like Danmar is one I think it's Danmar, but why don't we do the same thing? I'll just try and get the couple of links of places that I know you can get them from online, and we can post those after the talk.
Using recumbent bikes.
I don't know, actually. I don't think I've actually tried it. I have sent a couple of kids to a bike shop to get a recumbent bike, but I haven't actually used one with them. They were able to use them like a little bit more independently. But I think that it's great in order to avoid, falls. They can be a lot more, they're lower to the ground. So falling is that. I also think that there are some advantages to different styles of bikes. So as we talked about, strengthening has to be in an appropriate alignment. You use your quadricep muscles and your glutes differently in an upright bike than in a recumbent bike. And so it can also offer another means of strengthening in a different way, which might be beneficial.
Right.
Mm-hmm. Yeah, so there are a line of bikes called Mobo bikes. There's another one too, and I can't think of the name, but they're sort of like designed to be kind of like four-wheelers or like trikes. Oh, okay. Yeah. And so they're actually marketed to, not to a rehabilitation perspective, which does make things a lot more cost affordable. But yeah, I mean, absolutely. I was thinking specifically recumbent, but I think adaptive bike is absolutely, like has made the accessibility to participating with friends and siblings and in the community so much more accessible. There's also a company, but therapists at the University of Delaware that has started a company called, I don't know what you call it, like a nonprofit called Go Baby Go. And I don't know if anyone's familiar with this, but they basically have they'll have workshops throughout the country, but they also already have published online ways to modify equipment that's in the available like from Target or Toys R Us or something like that, in order to make it accessible. So how to change like the way you activate it, or I think in particular, like a little ride on scooter, they will make it so that you have to like stand up a little bit, like unweight your butt in order to move forward. And so it can help kind of with like it's kind of a therapeutic way, but also gets, a younger kid who's not able to walk out more mobile and able to interact with their environment easier.
My son currently has a pressure sore on the bottom of his foot, so standing is very uncomfortable for him. Do you have any suggestions to relieve that discomfort and keep him standing? I mean, I would try to find shoes that are cut out where this pressure sore is, if that's possible, so that he has more space before putting pressure on it. Are there other?
I think it's really important to see a specialist or a professional, because you don't want to like just buy a shoe that you'll put more weight on the front of the foot or the back of it, depending on where it is, and then cause something further complication. So it's just but yes, I think there are options that are available to accommodate that.
When you need a wheelchair, and like who determines that? Is there a quantitative test? Where do you get it? I mean, I see advertisements in magazines now for various different kinds of chairs, and I mean, I'm thinking maybe there's an insurance issue, something.
Right. So that's a yep. So you no, it depends on the, what your health insurance coverage is, and like, and the time frame from when you last got some piece of equipment for walking or riding or being in a chair. I think the other thing it usually requires is a series of several rehab appointments showing that you can't use something else, so that a walker is not effective at helping you maintain your balance without support, or you demonstrate that doing a 6-minute walk test, which is where we have people walk back and forth between cones for 6 minutes and see how far they go, to show that your endurance is decreased enough that you can't walk in the community. And those are the kinds of things that you need to support the insurance coverage of that kind of a device. I mean, ideally, you would have someplace that does an equipment appointment. If there's an equipment like clinic at a bigger hospital that you could go to, but you can also have any therapist contact the local DME provider, and they will send out a rep who will come and measure and determine the different things you need. I mean, it's really best if you can get the best type of cushion that would work for you best, because you want to avoid pressure sores, like that previous question. And then you also want to make sure that you're optimizing how you're going to use it. So usually you can't get a new chair for about 5 years. So if if you anticipate potentially some progression over that time, but you choose to get a manual chair that you push with your arms, but then in a couple of years you can't push that as well. I mean, usually you can use that as evidence that you need a new chair, but sometimes it's very difficult to get something that then has like power assist wheels or something like that. And then I think, yes, there's a lot you can buy off the internet, but I would say you have to be careful, because the same thing, sometimes you can't return things and they're expensive. So ideally you would order through some sort of equipment company that would help with specifications, and then with ordering, so you would be able to make modifications if you needed it. I think it depends on of course, why you need a wheelchair or you're wanting a wheelchair. And I think falling is a really important thing to keep in mind, because the main thing that predicts someone falling more or again is if you've had a fall. And that's about the most thing that all of the studies come out to say. So if you have had a fall, I think that's definitely a time to start thinking about having like some sort of assistive device to help, or maybe, and then I guess also decreased participation in your community is something that, especially for youth, is considered a quality of life matter. And so if you're not able to participate in your community, that can also help in, insurance coverage for something.
You said most of what I was thinking, but one thing I also was thinking is I would have a discussion with the physician of the child or the patient, just because you need rationale, right? And so if the physician understands the rationale, they can write that down, and that will help with coverage. But rationale could even be, I can't get him to the doctor appointment because now he can't walk that far, but something that is necessary that he's not able to do is what insurance will often really listen to.
like, when we were talking about bikes, I mean, I've seen bikes that, you know, like for sale on the internet or whatever. But, oh, wait, I know that would be safe for someone with limited mobility.
That's when I think you would work with your physical therapist or occupational therapist. They can to say, this is the wheelchair I'm looking at. What kinds of features should I be sure that I have? What kind of brands are the you know, the brands that are very reliable, that kind of thing. As I think you should, there's also, you know, I would tell you there's a lot of information on Google, but you want to factor that, you know, have a little bit of a criticism, you know, critical view of what you're gathering from Google, and go to reliable sites or your healthcare providers that know you or your son the best. Yes, it would be. I mean, it depends. So it depends on what your clinic. So occupational therapy often will do seating clinic, but sometimes physical therapy does it. So it depends on where you are and what your clinic, how it's set up, just to be kind of just to be sure. But most large rehab centers will have a seating clinic, and they will know information about wheelchairs, not just the seating part.
There's not a cost to have an appointment with a DME provider. I mean, they're kind of like a sales rep, right? So they're trying to sell you something, but I find that the people we worked with are very reputable. Like if there's, you know, a high-end wheelchair that's going to be expensive and isn't covered by your insurance, they'll get clearance beforehand about what your costs will be. You definitely want that up front. But if there's something that's available in the community that you can purchase on your own, they usually will recommend that. There are not a lot of providers actually still in that world right now, and they're busy. So if you are thinking that you are going to need equipment, you want to start early. So yeah.
I think you need to wear shoes that are flat, have good arch support, and fit your foot really well. That would be the starting point, right? Heavy shoes might be harder. So you kind of think about the weight, but it also is shoes that you'll wear, because if you hate them, you're not going to wear them, even if they if they work well. Do you have other?
I think it's really good to look at what your favorite shoe wear is like. And I don't mean like what the shoe looks like, but like, how have you worn it down? Because a lot of the time people are kind of catching their foot, and especially when they buy a new pair of shoes, it's even worse. Like you tend to go down right away. And a lot of shoe repair people will actually shave off the tip of the toe of the shoe, so that like if their problem is you're catching your toe, you can actually have them kind of shave the sole down a little and put some moleskin on there, so that then it'll be the same as your current shoes that are kind of wearing out, and you won't have to have such a break-in period for a new shoe as one thing. And the other thing I think you can kind of do is, if you get good orthotics, you can kind of make a pair of shoes last a little bit longer by just switching out the orthotics that go in them. But I think it's like running shoes, you know, like figure out the number of miles you can go on them before you kind of need a new pair, and not wait too long, because allowing your foot to, you know, rock or roll too much can just put you at risk of ankle spraining or things like that. Thank you very much for coming, and to the ULF for inviting us. We're around through tomorrow afternoon, so please just stop us in the hall, and we'd like to meet you or catch up some more. Thanks.